Um,
No worries, no worries. All right. Wonderful to have you all with us here at the beginning of summer, it seems like. We're in June. Quick reminder, if you guys want closed captions, this is how you get them. If I know this is a slide that's zooming by quickly, so if you want further support, just put in the chat and Cora and Ellie and possibly Liv, if she has extra time to do it, we'll tell you guys how to do this. Next slide. A reminder that this is a NIDA-funded initiative to advance the science on recovery community centers, and these are the people involved in creating the seminar series and all the other initiatives that go with it. We are now in our no-cost extension year, so a lot of the programs that we've had supported in the last couple of years, we don't do anymore in the sense of we don't have funding for them anymore. So the pilot study programs we are presenting results on, and we will hear results throughout the year, but we don't have any new grants to give out in that regard. But we're still keeping going with our seminar series, both for the pilot studies that are still finishing and for other topics that we are encountering along the year. All right, next slide. We are part of the Consortium on Addiction Recovery Science, here listed with some of the upcoming dates for activities, webinars, and other things that are happening. So this will be included in the slides that we will email out next week, and they will also be posted on our website, so you can get all the information there. And I do encourage you to check out a lot of these opportunities. So it's a wonderful, it's a growing and yet somehow tight-knit group, which I love, just like our group here. And they are our focus on recovery community centers, and in course, it is also other recovery support services as well as other issues and other topics in the addiction recovery space. Next slide. And speaking of course, here's a request to share information about a study that is currently recruiting, and they are recruiting peer workers serving rural counties. So if you happen to know a peer worker serving in a rural county who is interested in participating in a research study, please pass along this information here. And again, the slide will be in your the slide deck as well as, oh, and Tess, you're here. Do you want to plug it? You can plug it much better.
Mhm. I'll try to just do it super quick because I know we have such good stuff to talk about today. And I apologize, I won't be able to stay the whole time. I am double booked. But thank you guys for having me. But yeah, this study, I'm the principal investigator on this study, the lead researcher. I am looking, what we're trying to do is expand where we have services. So right now for this study, we're primarily focused in Southern Illinois because that is where Chestnut Health Systems is based out of, but we're looking to expand. And what we're trying to do is we're trying to work with families who have young adults who are struggling with substance use and trying to find innovative ways to bring them recovery services. One of those ways is through recruiting and training peer workers and some vocational and educational training that my colleagues have developed through focus groups working with young adults. There's free training, free support involved. There's also activities, stipends provided. And if you know anyone, particularly who are serving rural clients, who may be interested in providing us some support, just reach out. There's a QR code here. Thank you for Allison for putting the screenshot also in the chat. I've got the link there. There's like a really simple form that can be filled out. You could do it through your organization or outside of your organization, but we would need permission to do that. But if anyone is interested, we have some great RCOs that we're already partnering with who could also connect you with if you want some more information from their perspective. So just let me know. Hoping to reach 48 families, and we have officially enrolled 5 as of yesterday. So looking to continue on that path.
Perfect. See, I knew you could plug it better than I.
Thanks, Bettina.
No problem. Peter, go right ahead.
So just a quick question. How far afield from Illinois are you looking?
Oh,
Are you
anywhere.
like interested in East Coast, West Coast? It doesn't matter?
Nope.
Okay.
No
All
restrictions
right.
there. Thank you for asking. Yeah.
No problem. Thank you.
Perfect. And Peter, since we are plugging, do you want to plug the request for input on the strategic plan?
Oh, yes, absolutely. I just forwarded a letter to a number of folks, including Bettina, that is our formal request for input on the National Drug Control Strategy, which we will be developing in the near future. As a person in long-term recovery myself, as somebody who focuses on recovery policy, I especially put in a pitch to look for what do we need in turn to build the nation's recovery support services infrastructure, the peer workforce, what do we need to do to eliminate barriers to recovery. So I can either, if through Bettina, this could be forwarded to folks on this webinar, that would be perfectly fine. So that if you're interested, there's an email address and your input is needed by June 20th.
Perfect. Can we just upload the PDF you had attached to your email to this group here? All right, perfect.
Sure.
Ali, can you do that? I think you have that email. So just the PDF that was attached. Wonderful. Thank you, Peter, for plugging that for all of us. All right.
You're welcome.
So the other plug we always do is we always want to keep our list of recovery community centers up to date. So if you know of RCCs near you and we don't know about them yet, please let us know. If you have a moment, go to our website and check out the list that we have. And if there's anybody missing on that list near you, please do let us know, because we want to have that list up to date. If somebody asks us, who can I collaborate with, we want to send them a list and saying, here are the RCCs near you. All right. And now we can move on to the polling questions first. Wait, we're going to do the live feature first. All right, very good. So we're going to start here to ground us really in what is a recovery community center in a specific. We have here Darren and Phil with us today, who are going to tell us about their RCCs. So Phil, what happens when you walk through the doors of your RCC?
Great, thank you so much. Thanks for having us. So I'm not going to read you the mission, leave that for you, but what I'd like to do is ask you to take this walk with me through the community center. So imagine you're stepping into a space that feels safe, warm, and filled with hope. A place where recovery is not just a possibility, but a reality. Welcome to a recovery community center. Let's take a walk inside Communities for Recovery. So you walk through the front door, you're greeted with a welcoming smile, usually from a peer in recovery. There's no stigma here. Just understanding, no judgment. The coffee station is accessible to everyone and provided at no cost to any of our visitors. You'll notice robust resources such as bulletin boards filled with handwritten notes of encouragement, support group schedules, and recovery events. It's noticeably a space that is judgment-free and feels safe. So just kind of visualize the wall of postings, all the events that are going on, the other ancillary supports that we have available, meeting space, computer lab, clothing closet, which we haven't had since COVID, but we did run that for quite a while. So, this is about the human experience. So let's meet the people that bring the space to life, our peer support specialists. These are individuals in sustained recovery who provide support to others with shared lived experience, right? We qualify lived experience as any firsthand experience that impacts you so strongly it becomes part of your identity. You might walk in on any number of workshops at any given time throughout the day and the evening. You might see a trauma-informed yoga session, a family support group, or a recovery writing class happening in real time. Some of the group meetings we have a plethora of different mutual aid groups and other meetings. Mutual aid support groups play a vital role in substance abuse recovery by providing peer-led environments that foster community, understanding, and shared experiences. These groups offer a sense of belonging and practical coping strategies, which are essential to sustained recovery. We feel social activities are extremely vital. As a matter of fact, I don't think recovery for me would have been sustainable without maintaining a sense of humor and being able to participate in social events. But strong social connections provide that ongoing support, right? Encouragement and connectedness, they're essential for sustaining long-term recovery. So the next time you think about addiction recovery, don't just picture treatment centers or hospitals. Picture this space, these people, and this hope. Research indicates that environment plays a crucial role in recovery. RCCs, recovery community centers, bridge clinical and community-based support addressing social determinants of recovery. Studies show that RCCs increase sustained recovery rates by providing ongoing low-barrier support. Peer-led programs have been linked to higher rates of employment, housing stability, and lower return to use. So when someone walks into a recovery community center, they aren't just stepping into a room, they're stepping into a movement that is transforming recovery support as we know it. Thank you.
Perfect. Thank you, Phil. I loved all the pictures and I love how you put this all together for us. It's very vivid. Wonderful. All right. And now we're going to give you, hang on. Oh, right, the polling questions. I was going to go straight into presentation, but thank you for reminding us. So our next polling questions, as always, we're going to do a bunch of demographics, and then part of the polling questions is some questions that are previewing the content to come and the kind of questions that are floating in our minds. And of course, we're very happy to hear about your questions as we go throughout our seminar today. So if you can complete this poll, if you use the gray bar on the right to scroll down, once you have entered them all, the submit button becomes blue and you can submit it. And we typically wait until about 80% of us have completed this. How are we doing for completions?
85%.
I'm sorry, did you say 85?
65.
65, okay. We'll give it a couple more minutes.
Stuck at 79%. So
Ooh, so close. We like one more.
give it about 20 more seconds. So anyone who's still doing it. No dice. 79% minutes.
All right, here we go. All right, so scrolling us through the responses, I think everybody can scroll on their screen. So in 2024, which type of activity did RCC participants most frequently engage in at RCCs? And this is based on the RDP data that you will be seeing. And the current guesses, 44%, that the most frequent activity is engaging in groups, our recovery meetings, AA meetings, and so forth. A second was recovery coaching at 31%. So let's see what the data say. And scrolling down in terms of the common attendance pattern, what do we think was the most common pattern? And most of us thought it was 2 to 4 times. 53% of us thought that. And then we get to a question that we are thinking about. in your opinion, do the pros of data collection at RCCs outweigh the cons? And the majority of us, 83%, said yes, which is probably why we are at the seminar, which focuses on data collection. 10% of us thought that we need to think about it more, and 7% think no. And I'm hoping that those of you who didn't say yes will also speak up later when we talk about the pros and cons to really let us grapple with what are some of the downsides and things we need to keep in mind as we're doing more of that data collection. All right, next slide. Our presenters today are Joe Riggs and John Picard, who at this point probably look familiar to you all because I presented this project to you before they even started to get input. Who you have not met, if you go to the next slide, is our discussant. If you go to the next, do we not have it? Oh, we do. Jemima, and I'm hopefully I'm getting your last name right, Jemima. Is it a Frimpong? Am I saying that correctly?
Frimpong, yes, Frimpong.
Perfect. Jemima has experience with working with electronic health records, not in the recovery space, but in the clinical space. So she will comment from her work on that to relate to what Joe and John are about to present to us now. So she will start off our discussion when they're done presenting. And of course, everybody always feel free to put your comments in the text and speak up. And of course, we will discuss afterwards. And now I'm going to turn it over to, actually, do you have a slide here, Liv, on upcoming seminars? Should we go about that first? We have it later, right? Ellie will link the ones that are coming up. All right, Joe and John, I'm turning this over to you.
Thank you, Bettina. Thank you, everybody, for coming in. I'm going to start this presentation off, and I'll hand it over to Joe to talk about the actual data analytics. But basically, our pilot project is titled Exploratory Analysis of the Recovery Data Platform to uncover group associations between engagement and outcomes in RCC participants. Next slide. So I'm the IT manager at Faces and Voices of Recovery, and one of our products, programs that we have is our Recovery Data Platform, which is a very large platform that is used by RCCs and RCOs across the country, with over 200,000 participant records, 2 million engagements. It's been operating since around 2018 is when it really started out. So it's cloud-based, providing tools and assessments needed to implement effective data-driven peer recovery support programs. And it really assists those RCCs and RCOs with individual people who are in recovery, receiving services from those organizations, and organizational data analytics of recovery. And there's a lot of different data points, which when I give demos can be a little bit overwhelming, but it really is about the person's basic information, the person who shows up at an RCC, their demographics. How can we contact you? Why did they show up at our doorsteps? What was the reason for their coming in? And then the different engagements. And I'm going to talk a little bit more in detail about those, but from recovery coaching and telephone recovery support to attending a group activity. And then those different outcome measurements to get into a little bit deeper of recovery data. So things like the brief assessment of recovery capital that Bettina already mentioned, and recovery planning tools, goal planning, and referral tracking, things of that nature. And of course, RCCs are a place for people to come to different recovery groups, from 12-step type meetings to smart recovery to just having a safe space for people who are dealing with an SUD. Next slide. All right, so the person you see pictured there is Phil Rutherford. He was the COO of Faces and Voices of Recovery, and basically got RDP off the ground. And myself and Phil did a recovery seminar, I can't believe this, but a year and a half ago. So September of 2023, which seems a lot longer ago, where we discussed and we took a closer look at the Recovery Data Platform. If you want to go back and take a look at that, you can find the link on the Healthy Flourishing website. So why a Recovery Data Platform? Because recovery changes lives. I'm a person in long-term recovery from an SUD. I walked into my own local recovery community center, the Portland Recovery Community Center, to receive help, to receive support. And I'm one of those personal, powerful stories. So what data can do is really aggregates that information, and it can tell the story of the individual, somebody like myself, our local recovery communities that are utilizing RDP, and then aggregating it into state level or nationwide, which is what Joe and I have done. And really what we're trying to do is describe, diagnose, predict, and hopefully have some prescriptive information to be able to steer not only the individual, but the local recovery community and the recovery movement nationwide using data such as included in the recovery data platform. Next slide. So this is a screenshot of what RDP looks like. Kind of the upper left is a 1,000-foot level of an individual. So basically a recovery coach can click on a person record and see how long. So the upper level number there, that intake information, is 931 days. So that's how long this person's been engaged in recovery support services at this specific RCO. They've received a support and service 5 days ago. They did some type of assessment 32 days ago. There's some graphs, some trendings, things of that nature. So really, as a recovery coach, being able to see that 1,000-foot level of the person they're working with can be really important. And then the bottom right is just a simple snapshot of an organization-wide. So how many people are engaged and how many people are in active support, meaning they've had some type of engagement in the last 14 days is how we describe them. Or how many participants have in-progress assessments or working on recovery plans. So as a program manager or an executive director, being able to see that 10,000-foot level of what's going on at the RCO, RCC in respect to recovery metrics. Next slide. So what's the reason and how are RCCs using RDP? So community awareness is really important. I know I love receiving my local RCC's newsletter that a lot of times has data from the services that they're providing and how much flow of recovery they're providing, which is great. Grants and funding are extremely important for recovery community centers and recovery community organizations, and a lot of those grants require data. So RDP again is an easy tool for RCCs to be able to collect that data and easily report out. And then of course knowledge. So what's going on at the RCC on a aggregate level, and how can the services adjust to what's going on in our community? So really tracking and transparency. Data is really important when you're talking about transparency. So for the recovery coaches, people that are working with individuals, being able to schedule those engagements and easily know the next time I'm going to be working with somebody. Trending their recovery progress. We saw that screenshot of somebody's recovery progress, and one of those had the BARC assessment in a bar graph form. So as a coach, I can really see somebody's either rising or lowering recovery capital very easily, and then delve into it a little bit more, looking at the individual questions to see where they're progressing. And then for administrators, really being able to report out easily. And RDP has some really powerful reporting tools to be able to create your own reports using the fields that you want to see, the filters that you want to utilize, and really makes it easier for reporting out to for whatever reason is necessary. And then, of course, decision making. RCCs and RCOs have to make decisions based on the data that is being recorded. So one of those most important things is flow of recovery. So when are people coming in? How many people are coming in on certain days? Knowing what staff you need and when can be really important, and why they're coming in, also very important. So determining the needs of the population you serve. You might have, based on the data that you're tracking, people are coming in more for housing than they were last year, or people are coming in more for individual peer recovery supports more than they were last year. So being able to look at that data and really adjust services the services that you're providing to your community. Next slide. So a little bit of an overview of the variables that we utilized for this pilot study. So the different engagement types, recovery coaching, which is that individual one-on-one peer support session, group attendance, so somebody coming to either a recovery group, a community event, something that is based in recovery, volunteer log, which my start at my local RCC was volunteering, and my data is in my local RCC as well. But really important to be able to record that type of information. Telephone recovery support, which is that phone contact from the organization to an individual who wants that type of service, and of course that brief interaction, which is just a quick check-in. Hey, how are you doing? Didn't really involve much peer recovery support in depth, but it's an important engagement to see how people are doing. And then the different assessments from recovery capital. We have our own engagement scale data that looks at relationship and cravings and outcomes, anxiety, depressive scale as well, and then the substance use recovery evaluator. And then, of course, demographics. So from race, age, gender, and orientation or identity. So those are all the variables and definitions that we really took a look at. Next slide. All right, so now I'm going to pass it over to Dr. Joe Riggs, who we've been working together for about a year, and I'm really grateful that I've gotten to work with Joe, and will continue to work with Joe. So I'm going to turn it over to Joe and have him talk a lot more geeky than I just did.
Thank you, John. It's a pleasure to keep on this project, keep working with you. Thank you for the RCCs that contributed to this data that allowed us to gain deeper insights into recovery and RCCs. And thank you for the scientist and the principal investigator, thank you, Bettina, and the review team for supporting the ideas in this project and are conducting this research. We'll be discussing the analysis of RCC engagements and assessments. A lot of it today will include observational and characterizations of the RDP, as well as some novel findings, all under the specific aims of the pilot project that was awarded. Next slide. We chose to look at the most complete year, or the most recent complete year, to look at demographics on engagement types and assessment types. So we started with 2024, and we look into engagement patterns on type and frequency of RCC participants, as well as we perform an analysis on RC engagement among participants with and without an assessment at intake to see what their subsequent engagement looks like. The RDP in total for 2024 had 163 contributing RCCs, over 42,000 unique person records, and over 480,000 engagement entries. Altogether, telling a compelling story just how much support is being given at RCCs nationwide. And for those seeking recovery, a minute can seem like a lifetime. And RCCs logged in and reported over 14 million minutes of support, 14 million minutes of relief for somebody that's struggling. Next slide. One of the first questions we had was the consistency of RCCs to use the RDP and report. And we observed consistent and increasing usage. Consistent because in each month we saw around 85% or more of RCCs contributing to the RDP. And then in terms of increasing, in terms of both engagement and participants, we see that the mean engagement here on the right, which is RCC participants, continue to increase. As well, we see a total engagement from January to December increases as a linear trend. And we just see an immense amount of records being used each month. The over 30,000 records from January to approaching 50,000 records in December. These are all engagement entries in the left graph. Altogether, just complete and compelling story of how much support RCCs are providing. Next slide. And we wanted a general breakdown of the services that are being provided and what's being engaged with. And we see abundance of supports and assessments. The most, as mentioned, recovery coaching was the most frequent engagement activity of participants. As well, I think it's notable, I like, it's a personal favorite of mine, the volunteer logs. While their counts aren't extremely high in comparison, their duration of time and hours spent are. Really providing participants an opportunity to engage and give back. And for assessments, we see an abundance of assessments being provided and being taken. And we saw BART 10 being the most frequent assessment. And next slide. So this next set of slides will present demographic data on engagement and assessments on race, age, and gender. We can't go through all the numbers, painstakingly, but they're here for reference. One, the slides will be available on the Health Flourishing website, as well as a recording of the webinar, so people can go back and review the slides and pick out and see what they want to glean from it. But I do want to help navigate these slides so we understand how to read them and what we have. So in the first pair of columns for 2024 year, we have the total counts. And then those counts across a particular race are broken down to their particular engagement activity. So recovery coaching, telephone recovery support, etc. So for American Indian or Alaska Native, the total in 2024 was 8,205 persons with that race. And then the engagement activities will sum to those numbers. Meanwhile, down the column, you have the percentages across across the demographic. So of all the activities given, Hispanic, Latino, or Spanish origin was 3.53%, or Black or African American was 17.3%, and that will sum to 100 down the column. And then you can see what those percentages are on each engagement activity. That's for race. Next slide. And that similar pattern of reading, the data is for assessments as well. And here we see a breakdown of assessments on race and what was provided or taken across the different assessment tools. Next slide. And we have it for age. Next slide. Assessments for age. And next slide. And then again, activity for gender. And then next slide. Assessments for gender, all in that same pattern. Here, NR is not recorded, so some people don't provide their they don't provide data, or there wasn't a PHQ given potentially, but those categories are general. Okay, next slide. Here we're interested in seeing a comparison between. So these are the same numbers from the prior tables, from the total numbers. But wanted to pair them up and see it side by side, the percent of engagement to the percent of assessments that are being captured, so that we can see how we're comparing. And I leave it for those who to take from demographics, but we can see things that are may or may not trend the way we would hope. For example, assessments are 73% were contributed by white people, while the percent of engagements was 62%. That's on race. And then similarly, we have this for the next slide. For gender and age, the same kind of breakdown where we can compare the percents of engagement that's being conducted or being engaged with, and then the assessments that are being captured. Okay, those slides are there for your reference. We'll also have a meeting after the meeting where we can dig in a little deeper if there's any particular questions. And if you did notice something that you want to ask about, feel free. Questions are welcome at any time during this. In 2022, from the R24 NIDA fund, this funding, Bettina Hopner and colleagues published an article on the National Survey of RCCs, and we were interested in how the data from survey data from RCC directors compare with the RDP. And again, I let others read the numbers to glean what you wish. I see a high degree of consistency. There are maybe some differences. We could notice there seems to be a difference between 18 and 24, and what is being captured in the RDP, and then what was reported through survey from the national survey in RCCs. All in all, I think it's interesting. Next slide. We, you know, most of us, I think, appreciate that recovery is an ongoing process. So we're quite interested in who comes once versus who comes multiple times. And we were, pretty inspired that we saw that uh, a large number, group of percentage of people have come more than 5 times. And it could be more than five. We grouped them into one, two, three, four, and then 5+. And we see that nearly half come over 5 times. And in assessments, we see quite a few people that engage with have multiple assessments, allowing us to maybe gain further or deeper insights. And over 20,000 RCC participants engaged greater than 5 times in 2024. Next slide. As well as interesting is to know does somebody engage in one activity or they engage in multiple activities? And here we can see a breakdown through person's co-engagement. And so how you would read this if you come back to the slide is the bar charts are, for example, the very first bar chart means in a single dot would mean that recovery coaching was the activity here and it was engaged in uniquely. And so a person that engaged at our RCC only did recovery coaching. And of this data set, there's 3,511 persons. Now, this data set was from intakes that occurred in 2024. And then if you want to you say, well, there's somebody with recovery coaching also attend groups. And here we can see 2 dots connected by a line. 430 persons out of this data set did both. They had recovery coaching and group attendance. Now that was just those two. You can also see 226 people did recovery coaching, brief interaction, tough on recovery support, and group attendance. And that's 226 if you look at that bar. So you can see this by sets. You can see the co-engagement. And you can see the set size on the lower left, horizontally to group attendance, tough on recovery support, brief interaction, recovery coaching. And then while this was a subset of the entire RDP, we can look at their percentages to see what percent of participants in their co-engagement, which we could get an idea of by percent breakdown for estimating potentially. So 25% of persons only engage in recovery coaching, while if you look at recovery coaching and intersecting other types, you see other percents there as well. Okay, next slide. A question we were interested in is there an impact when providing an assessment to a new RCC participant on their subsequent RCC engagement? So here, in this data set, we looked at new as being an intake, somebody had intake, and did they have an assessment within 7 days of intake? We'll describe it a little bit more in the next slide. So there were 3 groups. Group A is everybody here has an intake. The intake was in 2024, and their engagement was in 2024. And so here, Group A is a participant that did not have an assessment. Group B is a participant that had an assessment within 7 days of the intake. And Group C is a participant that had an assessment but didn't meet the criteria. Either it's greater than 7 days or it had an inaccurate date. So just the date didn't make sense. for a variety of reasons. And so then um, to have a clear line of engagement that was separated from intake, we looked at their engagement between 30 and 90 days. So the person had an intake had an assessment within 7 days or no assessment. And then we look at the engagement across groups A, B, and C, 30 to 90 days later and count those up. Well, they get a flag for yes, they had one. It could be multiple within 30 to 90 days, but they had to have at least one. Were they still engaged a month later and within 90 days? And so we see between group A, B, and engagement yes, engagement none, engagement yes is that window of time, we see the proportions. And when you perform a chi-square on group A versus B, and looking for dependence or not, we see that having an assessment, different ways to interpret this, to express that. But we see that those that had an assessment engaged at a higher proportion than those that did not in that 30 to 90-day window. Here, the engagement types were recovery coaching, group attendance, brief interaction, volunteer service, as well as telephone recovery support. And here we filtered out telephone recovery support that did not have a confirmed contact. So it was a TRS with confirmed contact, so that there was so the engagement here is confirmed engagement. And I find that interesting and exciting myself. And we're looking into that further to understand a little bit more about what that means. Okay, next slide. So that's the findings that we have thus far. Limitations of the study is that data is voluntary and as such, underreports the actual engagement activity at RCCs and other measured variables. There's also real-world evidence, so it's not randomized, and so that the various biases. All in all, the data shows us how much support is being given to persons seeking recovery or seeking to sustain recovery, and the welcoming nature of RCCs to invite people of all types to their centers and be of support. And next slide. Questions?
What wonderful presentation. So much in there with great information, which is great to then pour over the slides later. Jemima, can you start us off with a discussion?
Wonderful. Thank you, Bettina. Good afternoon, everyone. And thank you, Joe and John, for that really insightful presentation. There's no question that the work that you're doing with RCCs and the RDP is truly impressive. And I think, in my view, really provides a valuable look into the landscape of recovery support, and does so by really leveraging a really remarkable and extensive data set. Your findings, as you've just shared with us, which are based on the RDP, in my view, really highlights the critical role of data in understanding and advancing recovery support services. We can sort of start by talking about the sheer volume of the data that you have, including the number of participants, over 200,000, the number of engagements, the number of RCCs, and also the number of states that feed information into the RDP. And when we think about all of this, there's no question that I think it positions the platform as a resource for really understanding the recovery pathway. I think it's unique. It's a unique data set in that way. And I mentioned, who's providing data, what the data looks like, but I think the scope of the data set also really underscores the potential that it has to really inform recovery efforts nationally. There's no question you did the comparison, and I think while it does not map on precisely, it gives signals that there's really a level of richness in the data that we cannot underestimate. Specifically the pilot study and what we learned from that data. It gives a broad overview of the type of participants that you're engaging with, the characteristics, and also how they engage with the services. And I think these findings are particularly encouraging. I want to look at your findings from the pilot at the organizational level, where we see really impressive total number of counts, about over 42,000 unique person records. That is not small by any means, with over 500,000 engagement captured. I think the consistency and the increasing pattern that you talked about really shows that engagement is trending upwards. You talked about whether this is a function of the number of programs themselves or engagement. And I think, based on the totality of the data that you shared, there's, enough evidence to suggest that it's not just the number of RCCs, but participants are also really engaging with the services that are being provided. I think at the granular level, the data on participant demographics, including race, age, gender, and sexual orientation, provides another foundation for understanding who is being served and how they're being served. There are some differences across these characteristics, but I think that's the beauty of having data, is to be able to say, while we're providing services and we may be thinking about it from one perspective, our participant needs may vary. And to be able to understand that, we need data to be able to identify those differences. And I think the data that you presented allows RCCs to be able to do that, and I think in meaningful ways. The exploratory analysis between the impact of assessment on subsequent engagement, I think also provides another lens into the data. We see that approximately 90% of RCCs participants have an assessment near intake, in your case, less than 7 days. Those who have those intakes have a subsequent engagement. And this is a powerful testament of the potential positive association between assessment and ongoing recovery. Earlier in the conversation, I think there was a question around the usefulness or the pros and cons, right? So one can look at these data points and say, to what extent, what are the trade-offs between engaging and collecting those assessment data and what we learn from the ongoing recovery support. So this is one example, and I'm sure others in the room could come up with other ones to support why I think the data that you're collecting and the assessments are really useful in this regard. I think for me, the key message, among others, is that assessments are not just data points, but potentially a catalyst for how we continue to engage people in recovery efforts. Yes, it takes time to collect data, but really it is a way for us to use data to inform the type of services that people are receiving. And I think the takeaway is that RCCs are demonstrating the value in the services that they're providing, supported by the data that they are collecting. I will sort of, end by saying that the presentation, in my view, effectively demonstrated the value of the platform in understanding participant engagement and outcomes. The findings regarding the association between assessment and subsequent engagement, for me, are particularly compelling. It offers, I think, actionable insights that RCCs can consider as they think about strategies and ways to implement assessments as a pathway for fostering continuous recovery journeys, right? So it's a snapshot, but I think it also gives some insights into how these, mini snapshots can be a key part of how we think about the recovery journey. I do have a few thoughts for the presenters. I've said a lot about the data. There's no question that I think is valuable. There's no question that I think assessments and the findings that we see with engagement is important. But I do also want to leave a few thoughts, which hopefully will sort of lead into the conversation that we'll have after. I think beyond the correlations that you show, I wondered about qualitative insights that may explain some of the whys of the findings. We know that there are associations, and I wonder if we were to talk to patients, what would they say in terms of why we see some of the findings that we see from your data? what are some of the mechanisms that are driving the higher subsequent engagement? Yes, we see that assessment has this relationship, but what are the different pathways? My senses tell me, based on the richness of the data, that you have data points that may offer some insights into that type of question. The data also focuses on individuals within 30 days or 7 days of assessment. And I wonder if there are plans to think about expanding this time frame to observe longer engagement patterns and outcomes. Of course, there's often a threshold. So I wonder if this, looking at the point at which we begin to see some changes, what is the pivot point when we look at the relationship that you talked about? And there are different types of engagement. You have explored different types of engagement, and I wonder if you plan to explore other types of engagement, meaning you have recovery coaching, you have brief interventions, and they don't always work the same way. And I wonder if there are stronger associations with one versus the other, and if you intend to explore the data in those ways as well, comparing the different types of interventions to see which ones have different associations amongst your population. I have other questions as well, but I realize that time is of the essence, so I will stop here and sort of open the room for others to chime in as well. So thanks again, Joe and John, for that really excellent presentation.
Perfect, wonderful, and your comments are so spot on and helpful. Thank you, Jemima. Peter, want to go ahead?
Absolutely. A couple quick questions. And before I do that, I want to say, if you happen to try and chat with me because of the letter being uploaded, I don't have chat on my iteration of Zoom, so I'm not ignoring you. So you'll have to email me. That would become an official record here, so they get very persnickety. First question would be, have you thought about adding additional instruments that are optional that you could look at? And do you feel like your data collection is consistent enough where you could look at set intervals in time and compare the BARC score to the services received, those kinds of do those kinds of analyses?
John, do you want to?
Well, so to answer your second part, yes. So based on, the way that RDP is put together and based on Joe's data analysis, I think we can look at, a BARC taken, the initial BARCs that are done, every 30, 60, or 90 days, because there's a scheduling tool inside of it, and what engagements they've done between those. I mean, that's some pretty high level data analytics, but I think it is a possibility given time, space, and Joe's intelligence.
Well, we were good until we got to that last part. No, I think so that's part of the pilot grant that we want to do that, as well as digging into the data we're working on those processes. But that's the hope, that's the aim.
And I will say the limitation in interpreting, for example, the SURE scores over time or the BAC-10 scores over time is that it's limited to people who show up at the RCCs. We don't know what happens to people who don't show up. And that's why we still need RCTs in the field who will follow up regardless of where people are going and how they are doing. But meanwhile, you do get insight of, for particular individuals. And John, I think you're showing that, 40,000 view for every single person for individuals that keep coming back. What is their journey over time? And I think the other thing that is incredibly important to highlight is, so you had 163 different recovery community centers who contributed data to this particular data cut, which is a lot of them. And I think, if I understand correctly, is each RCC, though, uses the RDP a little bit differently. So some of them might be using all of the features and some of them might not. Some of them might ask a lot of the participants to do the BAC-10, for example. Other people might only ask their staff to log, for instance, recovery coaching. Am I understanding that correctly, John?
That's correct. So it is the RCCs kind of their purview to use RDP how they want to use it. We don't kind of box them in, force them to utilize it. So one of the questions that was asked was about, what's going to be a higher engagement, recovery coaching or group attendance. and it shows recovery coaching. However, based on my anecdotal knowledge of the RCCs that I work with, so we looked at individual participant records. Now, in RDP, there is a way to track activity or attendance records just by saying 15 people showed up to this specific activity. So those numbers would be much higher, but we were looking at the participant themselves. So there are RCCs that don't actually do individual, or they don't do them as well as they probably could, individual participant records for group attendance to specific activities. So yeah, that's one of those data inconsistencies that we'll have to take a look at.
Wonderful. John, did you see the comment in the that I let you look at that? There's a question about cost to an RCC, and while you get ready to answer that question, I was going to ask Phil to elaborate on his point that he put into the chat about the BARC 10 use at RCCs.
Yeah, I just was talking about, well, one, like when we're talking about assessments, we always talk about them being self-assessments. People can refuse doing them, but we typically use them in a 3-month intervals. And when we come in, and I was just one of my notes was that interestingly enough, that one of the things that we see is we see higher scores when people come into peer support, and then it dips and then it rises again. And I think our assumption has always been that there's maybe a pink cloud effect that come in fresh and hit the ground running, and then reality kind of hits, or some barriers hit, and then it kind of reality sets in and you get more of a realistic score. But either way, the main thing that we're using it for too is it's a self-assessment for them to use the way they want to use it. Somebody might want to work on a life domain that they have a low score in, but somebody might also want to build upon a life domain score where they're high in, because they want to keep that ball rolling because they feel that success. So it really, recovery capital really, it has if used effectively, it can really help one just develop the relationships, because to me the hardest thing about metrics is it sometimes removes the human element, which for me, as a person with lived experience, a person that went through the doors at RCC and that received the benefit of peer support services, the human element is what kept me there and wanted me to do this work. So I'm always going against the grain on that sort of thing, but metrics is what keeps the ball rolling. So it's finding the balance in the two.
Mm-hmm. In that regard, I think it's so exciting to see that the people who did do the assessment were much more likely to not be turned off, but to keep coming back for follow-up visits. So even though it does take an artificial take back and here's an assessment, I think it all depends on how that assessment is being done and about conveying why it's being done and how the data is being used, that hopefully can take some of
I think
the alienating factor from it.
To your point, I think that proves that it's valuable, right? Whether it's a low score or a high score, is they're finding that engagement valuable. Somebody is asking me about my life or allowing me to look at my life in a way that I haven't before, or in a setting that I haven't been able to do before, or with a person that gets me, and really kind of explore some of these changes I might want to make, even if they're incremental, or I 2 steps forward, 1 step back, whatever, but it's meaningful.
So true. Amy, I'm going to get to you in just a second. John, do you know the answer for the cost question?
Of course I do. So yes, the minimum price for an RCC to utilize RDP is $2,000 per year, which provides you 10 licenses, so 10 individuals, administrators, coaches, whatever. So it's $2,000 per year annual subscription. Of course, we have additional products and things of that nature to assist with. And then I also wanted to answer Tiers' question, who's my boss, by the way. So she put in the chat, have you looked at referral reason source intake fields, such as involvement in regards to engagement? So Joe and I actually spoke this past week about getting, why did people come in? What was their reasoning behind showing up at the RCC? Because we do have that data. So that is one of the things we are going to be looking at going forward as well.
Wonderful. Then I will just note before we go to Amy that it is the top of the hour. So after this point, this is how far the video recording will go on the website. We will take notes and have those on the website as well. But that video recording for the next half hour for the meeting after meeting, if you will, won't be there. So we can discuss freely and not worry about us being video recorded for that part. Amy, if you wanted to go ahead.
Yeah, thank you. A fantastic presentation. I love the RDP. I love as a researcher that we're talking about data. But when I talk to recovery housing operators about data, it could be very intimidating. And something one recovery housing operator said to me once really stuck with me is that data is not the same as information. And I think that, whenever you're thinking about data as a researcher, as a program, that you really start thinking about what information do you want to have? What do you want to say? And then plan your data collection strategy around that, because you could do a lot of work collecting data and not get anywhere if you're not focused on what you want to say with it. So I do want to encourage people who are using the RDP, who are thinking about data collection, to really be focusing on how you want to use the information that you're collecting, or the data you're collecting, to translate it into information about your program, about your services, about your population. How are you going to use it?
Amy, it's funny you said that, because when we give RDP training, one of the quotes that we use is, you can have data without information, but you cannot have information without data. So it's really important that when we not only demo, but let's start working with somebody who's utilizing RDP, because they understand, that what the use of data is. So that's one of the quotes that we use, which is quite funny. Another thing I just wanted to say about the price, for those of you who might be interested, and if you're a recovery community center or a recovery community organization, and you are looking at being ARCO certified, so the Alliance of Recovery Centered Organizations, which is another program in Faces and Voices of Recovery, you get a 50% discount. So instead of paying $2,000 a year, it would be $1,000 a year for the 10 licenses. This is an aside.